Thank you for joining us this morning. We just thought it was important in light of the last few days to provide an update on the current dengue fever outbreak on Hawaii Island. Just a couple things I think is just important reminders. You know, in our response plans, the focus really is on ensuring that those closest to the situation have control and really drive the activities. So the County of Hawaii is the incident commander, and they are the ones that really know the communities best and are in the best position to make the most important decisions about what the government response should be. So I just wanted to reiterate that the state and the federal government is really providing supportive roles to support all of the activities for those people on the front line. Just wanted to remind everyone that we have been working with the Centers for Disease Control since the very immediate start of the outbreak. And they were very impressed with how we were organized and made the comment, certainly that in many instances, they are called into situations where things are not working, and they were overwhelmed by the amount of cooperation between the state and county agencies and how well we were organized. And more importantly, their assessment was that we are doing the right things, that the response was appropriate. A couple things that they reminded us is that there are no shortcuts to a dengue outbreak that they had anticipated in most instances. It carries on for months, and that we needed to be prepared, that this is not, there's no shortcuts, you know, that a dengue outbreak requires consistent response. And, you know, we are fortunate in our communities that our civil defense and emergency response teams are professional and well qualified. And this instance is no different. Mayor Kinoy and his team on the Big Island have been on it from the first report. And they've done a terrific job of engaging the communities, engaging us, and we've been cooperating with them from the beginning, providing the resources that they need to ensure that we can respond on behalf of our communities.
Session will convene in 15 minutes. Members of the House, session will convene in 15 minutes. Pause.
So I just would want to thank Mayor Kinoy and Chief Oliveira for joining us this morning so that we can provide to all of you a coordinated response and update on the dengue fever outbreak. Mayor Kinoy?
Thank you, Governor. Thank you, Governor. I want to say aloha to Governor Ige and his team at the Department of Health and Civil Defense, General Vern Miyagi, who we've worked very closely with through Tropical Storm Marcel, through the lava threat to Pahoa. You know, I also want to thank, I call him Chief, our retired fire chief, but one of the best civil defense administrators, proud to call one of our members of our team, Chief Darryl Oliveira. Just wanted to convey to everybody, in any emergency, in any disaster, communication and coordination has always been the key. And we've been very appreciative of the coordination and support we receive from the Department of Health and from State Civil Defense. We received our first briefing on November 4th that informed us from the Department of Health that we had a potential dengue outbreak and a threat to the community. We immediately stood up what is called our EOC, or Emergency Operations Center. That very day, as we got data, we found out that there are some common threads, i.e. Ho'okena Beach Park. We found out Hawaii County issues 44 camping permits. We immediately contacted every permit holder and closed Ho'okena Beach Park. By November 5th, we were immediately gone into action and said all breeding areas for mosquitoes, tires, that the County of Hawaii would immediately begin taking in tires. People, please, we know we needed the community support. We know we had to effectively convey accurate, timely information. And so by November 9th, a week later, we had our first community meeting in Kona. We had Dr. Virginia Pressler, Director, Department of Health, all of our DOH and County of Hawaii employees, beginning going into the communities. And we've held 13 community meetings thus far, collected over 7,500 tires at our transfer stations around the island, work with our community complex area superintendents, making sure our schools were safe. So the Department of Education, charter schools, private schools have all been part of the prevention and management of the outbreak of dengue. I want to turn it over to Chief Darryl Oliveira to kind of inform all of you a little more in depth what has been our coordinated response, because in any emergency, we have to coordinate federal, state, county agencies and multiple agencies within each level of government. We have to work with our legislators and a legislative branch of government at every level to provide resources and support. But thus far, we've been working well together. For example, Department of Health will have their vector control. And what we did was take our Parks and Recreation and Public Works employees and begin training them on and embedding them with the Department of Vector Control. So that it wasn't a question of resource availability, that we were able to execute a strategic response to make sure that information, education, outreach, coordination and communication, community response, and covering all of the bases that we needed to do. So I'll turn it over to Chief Darryl Oliveira. And in 8 years, the privilege of being mayor, we've had a couple tsunamis, couple hurricanes, lava flows, dengue. The good thing is, the thing that the people of Hawaii should know, as visitors as well, on any given day, we have 194,000 residents on Hawaii Island. We also have about 26,000 visitors. And our job is to ensure that people know that Hawaii Island continues to be a beautiful place to live, work, and play for our families, and that Hawaii Island continues to be a special place for our visitors to come and visit. That we have great people who spent many years in responding to very difficult, challenging situations. But what we do know doesn't work is finger pointing, excuses, or blame. We do know that an honest assessment, coordinated response, effective communication, and managing expectations. And as the governor said, we're in it for the long haul. We've got challenges up ahead of us, but as long as we keep working together, as long as we keep helping each other, providing the necessary resources to the professionals who are doing a great job. So I want to thank all of our hardworking employees who are working 7 days a week in every community. And when an issue comes up like, oh, people cannot get to the doctor, they might not have insurance. So we said, hey, we got our emergency medical personnel, we got our fire response team, we got a fire station in every community. Let's make that available. Let's take our EMS personnel and send them into the community so that anybody who cannot pay or doesn't have access to a physician or healthcare facility, that they have somebody right there who can test them, send it to DOH, and be able to make a strategic coordinated response. I just wanted to make sure that convey that. So mahalo, everybody. Mahalo, Governor. Thank you, General and Chief. Chief.
Thank you, Mayor and Governor. Again, I just want to say thank you for this opportunity to share some information and maybe answer some questions. It's no secret that over the last almost 2 years, the Big Island has been hit with numerous events or emergencies, and each one we've responded to in a very similar fashion, and that is to start off with some basic objectives. And that is, first and foremost, is to maintain situational awareness of what's happening with the event. In many weather events, obviously, we're turning to the National Weather Service. If it's a tsunami, we're looking at Pacific Tsunami Warning Center. These are the subject matter agencies that give us guidance on what we can expect with regards to impact. In this case, with a health outbreak, Department of Health is that lead agency or subject matter authority that we turn to for guidance and expertise on this outbreak. So upon receiving the information on November 4th, we'll put into play some of that, maintaining that situational awareness, informing our stakeholders. We conducted a briefing in our EOC, which is standard operating procedures, and making sure all the stakeholders are well aware of what's happening on island. During that briefing, the mayor took the opportunity to stress 4 basic things or start 4 basic initiatives. One is to direct myself to immediately start to work very closely with the Department of Health on the beginnings of the response to the outbreak. 2 is to take proactive measures with the closing of Ho'okana Beach Park to reduce the continued risk and exposure to the community. 3 was to ask Department of Health to continue to work closely with our office and to establish a unified command on island so that we can coordinate the response. And then 4 was to reach out to the governor's office and ask for continued support and assistance if needed. And I can say without any hesitation that from the very get-go, the mayor and the governor have been 100% supportive of the response that we've had. There's been no hesitation to providing resources when requested. And I really appreciate the proactive nature that the administrations have taken with giving us the resources to, one, partner and then respond. The next things we did was initiate the response plan based on some clear objectives. The mayor touched on a few of them. One was to support or develop a structure that would ensure a good flow of information and a very collaborative coordination of the response. We established a unified command comprised of myself on the local level and then Keith Kawoka at Department of Health as the deputy director. We stay in close communication. Initially, for the first month or so, we were having daily conference calls to discuss the operations. As things became a little more organized and more structured, we were able to do that on a 3-a-day week, and that's where we're currently at, having a Monday, Wednesday, Friday conference call to make sure we maintain close communication and collaboration on the response. During those conference calls, we have all of the branches that we established reporting in, sharing their input with what they've been experiencing, what objectives they've accomplished, as well as participating in the development of the strategies going forward. The branches that we have include our investigative and surveillance branch, which is led by Dr. Park. That branch is tasked with identifying, tracking, monitoring the cases, as well as providing us guidance on what could be potential areas of concern, areas of high risk, areas of interest, clusters of cases, so that we can adapt or modify our strategies accordingly. Another branch that we have, as the mayor pointed out, is our vector branch. Now, early on, it was clear that this was going to be a long-term response. And when we look at the Maui outbreak, we're looking at 9 months. When we looked at the Florida outbreak, 18 months. So we knew that we had a significant time period to go before we would see any decrease in the cases. And some of the unique challenges we have on the Big Island are environment. We have some very unique environments out there that definitely are good breeding grounds for propagating the 2 vectors, the 2 mosquitoes. We have very rural communities with limited access to health care. And we have challenges with populations that may be not reached effectively due to either barriers language-wise or socioeconomic-wise. So we had to overcome many of these things as part of the response. But our vector team was identified as playing a critical role in going out and treating the cases, both suspect and confirmed cases, for the adult mosquito in an attempt to eradicate or basically remove possible infected mosquitoes in close proximity to those cases. Realizing that they had limited resources, again, a partnership was strengthened between the county and the state, as the mayor pointed out, training county public works, park and recreation employees to then supplement or complement the Department of Health vector teams. The mayor approved the purchasing of additional equipment, the sprayers that are used to treat these properties, as well as the Department of Health relocated equipment from the other islands to the Big Island. Presently, we have every one of the sprayers that's in the state on the Big Island available for use and deployment on a regular basis. And it's been a very aggressive approach to the treatment. The other 2 areas we have as far as operations branch, we have a public education branch. We've been working very closely with Department of Health to make sure the messaging going out is very clear, concise, accurate, and timely. And then our last branch is with our risk reduction branch. And this is teams comprised of civil defense personnel along with community volunteers, our citizens, community emergency response team, our CERT teams, going out into the communities, identifying areas of concern or issues of concern like stockpiles of tires, abandoned vehicles, white goods, and taking corrective action to either remove, to treat, or somehow mitigate these hazards to lessen the breeding grounds of the mosquitoes. Many of the responses that this team goes out on is based on information coming in from the community. To date, we've had over 250 complaints referred to us, and I feel very comfortable in saying that well over 200 of those complaints have been closed out, which meant the teams went out, mitigated the issue, corrected the problem, and made contact with the reporting party and gave them assurance that action was taken to mitigate the concern. We do have some outstanding issues. In many cases, these are of magnitude that require a more comprehensive cleanup. Fortunately, many of these cleanup areas are not in proximity to confirmed cases, therefore the risk is very low. But it's brought to the surface the importance of providing programs to help people get rid of their waste, which is going to provide opportunity for vector propagation. So again, it's been a very aggressive response from the very get-go, a very collaborative response from the very get-go, and it continues to be that way. What I do apologize if there is sometimes a lack of information flowing to the public, which then triggers maybe miscommunication, misinformation, rumors, or inaccurate reporting of what's going on. That's on me. I take that very personally and seriously, that I can do a better job to provide more information to our community.
It's really on me. It's not on their home.
But again, that's one of our objectives in any response, is to make sure that we provide the community with accurate, timely information about what's happening so that they can make good decisions to take care of themselves and their families. And that's an area that we can improve, and we're making improvements. So at this time, I'd like to turn it back to the governor, or sorry, to General Miyagi from State Civil Defense Hawaii Emergency Management Agency.
Aloha, everybody. I just wanted to say that from the State of Hawaii emergency management perspective, our job is to support the counties. That is our job. We're not the lead. We support the counties because the counties know exactly what is needed within their jurisdictions. This is a very unique event. With hurricanes and tropical storms, we primarily lead as far as support to the counties. We have LNOs within the EOCs at the counties. This is a little bit unique. This is Emergency Support Function 8, which is public health and medical support. So the lead on this one is Department of Health. So HIEMA's role in this one is to provide support to both the county and especially to the Department of Health, Keith Kaoka's people, in their provision of support to the counties. We have coordinated, our job is to coordinate support. During the event, we did do some requests for assistance to the Big Island. We moved some spraying equipment and supplies to our National Guard aircraft on opportune airlift, so this was at no cost, part of training. And throughout, we have supported them with VTC capability so that the Big Island, Darryl Oliveira and his people can share what the lessons learned were in the Big Island with other counties like Maui, Kauai, and Honolulu, so that they get an idea of the lessons learned and what actions they need to take at this point in time. We've learned a lot from Maui Civil Defense, Department of Health, Lauren Pang, there, Dr. Pang, who did the event in Maui years ago. He contributed a lot of information as far as after-action points that they learned in the Maui event. So a lot of this coordination has been ongoing all the way through. One of my biggest issues, right, is that my job is to coordinate the federal support also. There's been a lot of discussion about the declaration, where the declaration is, and so on. Now, the process is that we were already working on the declaration over the last couple of weeks. Darryl Oliveira and the mayor called us early on to say, if this thing ramps up, we got to get ahead of it. So what is the next step? And the next step is the governor's declaration. And just last week, we were getting the final input to that declaration. And in fact, on Friday, I was in Dr. Pressler's office with Keith Kaoka, and we were on the telephone with Darryl Oliveira, and we're talking about what is called the Emergency Management Assistance Compact. This is something that would come aboard in the governor's declaration. And what it is working with other states and counties and territories, resourcing, inventorying what medical support that they could provide in the event that this thing went higher and higher. So this is in process right now, and we already have the final draft of the proclamation, and that's going to be worked on and coordinated more. Now, one of the criteria for the proclamation is that if we have used all of the available resources within the county, within the state, and based on the length of this event, we are slowly getting there. So we need to get ahead of it and start doing that. But that's where we are now. So it is ongoing. We're coordinating with the federal side. We're coordinating with other states and territories to line up the resources that will be needed to get here. And we need to go through the process because it is a legal process. And any kind of reimbursements would be key on that process, and we follow the rules on that. But that's where we are now. But I got to say that over the last 2 years that I've been doing this with the Big Island, and we talked about Isel, we talked about Pahoa Lava, we talked about the 15 storms last year, now we talk about dengue. You know, I've been to a lot of these things, but this is the first time where I go to community meetings and the people there give them a standing ovation because they're sharing that information. I think some of you have seen this if you've gone to the community meetings. So this is a good example, I think, of how this kind of event should be run with the transparency and the sharing of information from the people also. And that's all I got. Again, thank you for the opportunity.
Thank you. So I think we'll be open to questions. I think most importantly, the decision to issue an emergency proclamation is one made by professionals in the best interest of what is needed by the community. It's something that we discuss early on in any event. I think we were talking about it. The first draft of a proclamation was done in November, and there is continuous conversation about it. As we proceed through an event and we identify what course of action is required, then we make that assessment. And there have been conversations about whether it's appropriate or needed or not. But those decisions are truly made by the professionals in every instance. We'd be open to questions.
Are we close to making a proclamation?
Yes, at the local level, at the county level, the mayor and myself have been discussing this for some time. And yes, we're very close to making, at least on the county level, the proclamation and a request for the governor's declaration. And as was pointed out, it's not because we don't have control of the situation or at any shortage for resources currently, but we'd like to stay ahead of the response, knowing that, as I mentioned in my brief, that we have all of the resources on the Big Island dedicated to this response. If there should be an outbreak on another island, those resources will either have to be relocated or an island is without resources for their response. So with what's going on globally with other outbreaks, we'd like to make sure we have adequate resources and the process is in place to obtain more if needed.
What kind of resources are we talking about?
Well, if we look at what was being used for just the support of the vector operations with the sprayers, every one of the sprayers that was available in the state for the application of the adulticide is on the Big Island. If there should be an outbreak or a need to treat properties elsewhere in the state, we would need to relocate some of that equipment, which could leave any one of the counties with a shortage of equipment. So we'd like to be ahead of that, have the mechanisms in place that if we need to request additional resources from nearby neighbors or partners, we can get that available and mobilize quickly.
Just sprayers, or are you looking at resources like money?
Well, obviously, those processes would also open the doors for access to other funding mechanisms. But at this point, as I mentioned in the brief, at the county level, the mayor has not in any way limited our spending. Obviously, we stay within our budget, but he has committed what financial resources are available to the response, to the degree that we've even at the county level been purchasing repellent and making that available for distribution at various community centers, community outreach opportunities to put repellent in the hands of people who are less fortunate and cannot acquire the resources. So, the county has been spending or expending resources absent a declaration or proclamation, but those two documents would open the doors to other funding mechanisms.
Last question, how much money have you spent so far?
Mr. Mayor, would you like to answer that?
Well, we spent a couple $100,000 so far, just in equipment, purchasing repellents, as the chief said, for vulnerable populations. We didn't want to disrupt the marketplace. We learned that in a cell. If you buy up everything, government buys up everything, it prevents people who might have the means necessary to go and purchase it themselves. So we made sure we contacted retailers, wholesalers, everybody was stocked, and then we purchased subsequent to that. We took a direct shipment, got some donations, and made sure that we distributed those supplies to those who were most in need. But when we do our emergency operations center, so any event, if we get a call, National Weather Service, there's an earthquake in Chile, we don't have just first responders in the emergency operations center. We have our finance department, we have our corporation counsel, legal review, legal advice. So all of those emergency proclamations and availability of resources just automatically come into play. And as Chief said, it's that flexibility. And we just, I think they're all working on it. When they get it back to us, we'll be ready to go.
And I think it's just important to reiterate, if you just look at the cases, we are actually making progress. The number of cases have been fewer and further between incidents. So clearly we see progress, and we don't see any kind of acceleration of cases occurring. The appropriate actions have been taken, and we are seeing significant reduction. So
I'm not sure who's best to answer this, whether it's you, Mayor, or you, Chief, but in terms of response time, so once a person believes that they may be infected and gets tested, how soon should they hear back, whether it's from the county or from Department of Health? Because those are the questions we've been hearing.
We have a whole protocol around how many hours we want to make sure we get out to the property. We do an assessment, we do a spray, we make sure there's testing, but I'll let Dal tell you that.
Yeah, as I mentioned earlier, we early on established objectives for the different branches. With the vector control branch, the objective was to spray or treat a confirmed or suspect case within 96 hours of notification from the lab or from the disease investigative branch. To date, the vector control has far exceeded that expectation. On average, they are spraying or treating properties within 24 to 48 hours of notification from the disease investigative branch.
And that's notification of a suspected case or a
Both. In many cases, information is collected first, and there's a process before the lab work actually is returned with a confirmation of either a positive versus negative. But if there's enough information that identifies this case as a suspect case, symptoms, history, et cetera, that information is still relayed to vector control to take action and spray. And the one caveat there is we do need permission and consent to treat these properties. So the initial contact is by vector to go out, obtain consent to then schedule the spraying, which is usually the same day, if not the next day if no one is home. Information is left behind that if no one is home to please call vector control or our office, as well as they do reach out on a confirmed case. They will go out 200 yards from the confirmed case residence or point and identify other sources for mosquito breeding, et cetera. On a suspect case, they're going out 25 yards from the residence and treating.
And then the next question, and Mayor, you touched on this.
Yeah.
There have been questions raised from folks who say that while the testing is free, they've been getting charged for the clinic visits or for the doctor visit to actually have their blood drawn. Can you clarify what resources are available?
Melika, that's getting into, whether people went to a private hospital, public hospital, community health center.
Okay.
We've been working with Hilo and Kona hospitals, our Hamakua, Ka'u, our community health centers. Everybody's coordinated. We've asked everybody to come into play. Hawaii Island, like we said, it's a big island, but small communities.
Right.
We're easily able to communicate and share information. But as to people making their own payment and their own visits, I don't know about that.
So whether this is a misunderstanding then or a misclarification, there has been the statement circulating that if there was an emergency declaration at either the county level or the state level, it would prevent or prohibit doctors from charging for these visits to get tested in the first place. Is that inaccurate?
I've never heard that.
I'm not aware of that. We definitely want to, look into that as a concern with the AG's office, obviously with the law. But what I'd like to clear up is that the state lab that is running the test, that is processing the specimen, is not charging for that. And you're correct that there are the intake services that may be charging for processing of the fee, whether it be your private physician's fees or if you went to let's say a commercial lab. But what we have been assured by all of the medical facilities on our island, that includes the community health centers, the hospitals, the bay clinics, the urgent cares, et cetera. We convened a meeting, again, as part of bringing all the stakeholders to the table, and we were assured that no one would be turned away for inability to pay. And that's the main thing. The other thing is the mayor and Department of Health have committed to ensure that people who don't have access, there is a safety net. We've gotten the administrative rules modified for the Department of Health to accommodate letting the paramedics from the fire department do field blood draws, which is outside their normal scope of practice. Again, the paramedics normally would be operating under a 911 call. Right now, we're talking about situations that may not fall into that category, but people looking for confirmation or access to an assessment or a means of getting a blood draw into the lab if they don't have availability of health care. So we've been sending out what we call multidisciplinary teams comprised of EMS personnel from the fire department along with public health nurses. They do an assessment, and we've already done blood draws in the field using our EMS personnel.
Mayor Kandalai, you mentioned that there are still challenges that lie ahead. What are those challenges?
Well, with, in any challenge, right, there's always a question of predictability and certainty. And if we were certain, take the lava flow, for example. On one day it moved 300 yards. If it was 1,500 yards away from town, it'd be 5 days away. Right? So you tell residents you're 5 days away. The next day it moves 100 yards. Now, it moves trees. Now you're 15 days away. So that uncertainty makes it difficult to make strategic decisions in response. Some people wanted us to bomb Pu'o. Why don't you bomb and divert the lava? And we said that would create too much unpredictability and too much uncertainty, and we would not make that strategic decision. When we talk about the challenges lying ahead, when I talk to the smart people, and my job and the governor's job, well, this one's smart guy, it's engineers, but us guys, my job as a decision maker, chief executive, is to consult with the Department of Health. And I want to recognize Keith Kawaoka. It's my first time I met him today, but throughout these many weeks, I've always asked Darryl, hey, who are you talking to over there at DOH? What kind of decisions we getting made? And he'd always say, oh, we get Keith Kawaoka. And so I told him today how much I appreciate hearing his name associated with timely information and response. So mahalo, Keith. Thank you. I'm trying to get him to move to Hawaii Island. But the uncertainty is, how do we extinguish dengue, right? We're at 244, right? About 199, we're 244, added 2 today, I think it was 246 now. But, it's a question of visitors, residents, how much online, how long will this last? Maui was 9 months. We've heard other jurisdictions, 18 months. The first onset of cases was September, notification, October, confirmation, November, we begin this coordinated response. So when I say uncertainty, what lies ahead is how much resources will be ultimately necessary, how much personnel, how much time. And so, but I truly believe through experience that when we all just work together, that we go into the communities and convey accurate, timely information, and that we respond rapidly, that we can hopefully contain this. But we have to be certain that we manage expectations as well. As we look around the world, World Health Organization just yesterday said the number one global crisis threat is Zika. Make sure I pronounce Zika. So, San Diego is experiencing the Asian tiger mosquito threat, which is the Aedes aegypti and Aedes albopictus. It's funny if we say that because I spent all night memorizing them. But the point being that it's a real challenge. We have international airports. We have multiple destinations from around the world that visit Hawaii every day. Our job is every day make sure, in working with the governor, that we keep everybody safe, residents and visitors alike. And we will do everything we can every single day with no hurdles, obstacles, or barriers in front of us. We'll do whatever we can together to make sure we keep everybody safe.
I think one of the comments made just in terms of uncertainty goes back to the CDC report really did identify the fact that, at one point in time, the Department of Health had 54 vector control employees that really was in the business of taking care of these potential vector sites. And most of them, the majority of them were eliminated in the reduction in force in 2008. And we right now are thin, and we do know that. We've reallocated resources statewide to respond to the Big Island outbreak, and we do know that makes us vulnerable in other places. And so that really is the next step. What can we do to ensure and restore the capacity within the Department of Health so we're better prepared and we can get ahead of the next outbreak, wherever it happens, anywhere in the state?
And Governor,
So speaking of outbreaks in other places, we understand that there's letters going out to Maui residents warning about either a suspected case or a confirmed case. Can you guys touch on that?
Keith Kawaoka, Deputy Director for Environmental Health, Incident Coordinator for the Department of Dengue Outbreak. There are cases that we have from time to time notified about potential cases that are brought in or imported into the state. The Maui case, we are investigating those kinds of cases right now to see what the prevalence is in those situations. So if we find confirmation or is suspected, they will do basically the same protocol as we're doing for the Big Island right now, both in terms of surveillance, spraying, et cetera, also identifying particulars of the case situation for the Maui.
So to clarify, does that mean that spraying is not yet taking place on Maui?
They are looking at each case individually and determining whether they need to spray those kinds of situations. So I'm not familiar directly with that particular situation, but that's the protocol we have for the Big Island right now, that we have confirmed a suspected case, like Chief Oliveira has said, that our vector control teams will go out and do some perimeter spraying and surveillance as well.
And how many suspected cases are on Maui?
I'm not sure of the total number. I can't tell you the total number. I don't want to give you a number and it's not right. So I don't
But
know.
it's more than one.
Quite possibly, yes.
You seem to be implying that you think that it was brought from somewhere else. Are we not thinking?
Typically, these kinds of cases are brought in from a traveler or resident that have traveled to these kinds of areas that have these kinds of diseases prevalent in those countries or those areas, and they bring it into Hawaii. What we don't want, obviously, to make that disease be endemic into the area as an ongoing situation.
So we don't know if this may have come from Hawaii Island.
We're not sure about that right now. We're not sure. And I don't want to answer one way or the other.
No, never.
Yeah.
I do think that it's important that dengue cases occur routinely in the state of Hawaii every year. And it comes from travelers going to visit Philippines, other areas in the tropics that dengue have become established, and they get bitten and they return. And so it is not unusual for us to have a number of dengue cases each and every year. Now, when there's an outbreak and it becomes established in an area, that's a different situation. So I guess the challenge for the professionals in the Department of Health is to truly look at each individual instance and make a determination about whether it is, in fact, the case traveling between islands, which we obviously want to respond to, or it's an isolated case where someone has traveled to an infected area, gotten bitten, got the disease and brought it back with them. And that's a different kind of response that we would want to.
So when can Maui residents expect additional clarity on that distinction?
We need to identify for that particular case or cases in this case, whether that person did bring it in from we have to need their travel characteristics, if they did travel to these areas. And two, and the most important one is, are they still infectious for that particular situation? So our epidemiologist teams, specialists need to look at all those different parameters to see whether that case is an isolated case or it could potentially be an infectious case to spread to other areas.
Any further questions?
Yeah, you mentioned earlier that all the sprayers have been diverted to the island. Just wondering if you can tell me if there are any other resources that have been diverted, and if there's a need to address something in Maui, how you'll handle that if they're all currently needed right now, where they are.
In addition to the sprayers, each of the counties' State Department of Health vector offices have been supporting the on-island vector teams, as well as entomologists have been moved from off-island to the Big Island to support the operations. Those resources are more transient. They come in for a period of time and then go back to their home island. The plan would be is if there was a need for mobilization of resources back to Maui or any other island, the most expeditious way, whether it be through one of our commercial carriers or, as General Miyagi pointed out early on, when we needed to move equipment expeditiously through State Civil Defense, Hawaii Emergency Management Agency, General Logan, we use National Guard resources to move assets as quickly as we can.
I have one question on they have a big queen bee industry in Kona. Is that being affected, or are they?
Well, that's one of the reasons why the product that the Department of Health Vector Control is using as part of the treatment, the aldalticide, is a very effective insecticide. And on its labeling, it does caution about the impact it could have on bees and other. And that's why I think it's important that we clarify for the community. It's not a fogging, fumigation type of an application that is used. It's very discrete and specific, targeted spraying based on the survey that is done by the vector team. So we're trying to balance the response, obviously, and the appropriate treatment, but are sensitive of the environmental impacts that could come with the product. And that's where we're following the product labeling, as well as consulting with CDC, consulting with the Department of Ag as far as alternatives as well, because in addition to, let's say, the beneficial insects that we have, like the bees, some of these could have aquatic impacts on some of the water habitat. So again, there's a constant collaboration between Department of Health, our office, Department of Ag, and other subject matter experts on the appropriate treatments and chemicals to be used.
I think they're in their peak season right now for getting the queen bees exported to the Midwest.
And fortunately, around that area, again, the cases are addressed by vector. They go down and do a survey of the properties. And if they identify, and the value to, again, a collaborative response is that we bring all of the personnel that are familiar with the island to the table in the EOC, bring in, local knowledge of the environment. The reaction to YPO Valley was based on local knowledge of the environment there, because we didn't see a large number of cases, but anyone who's been to YPO Valley can appreciate the environment there posing some challenges for vector, as well as a significant, rich environment to propagate the mosquitoes. So we have to adjust our strategies according to our community. There is no one shoe fits all. And that's, again, the value of an on-the-ground collaborative response, everybody coming to the table and discussing the uniqueness of the community and the challenges that we have to overcome. Sure.
Anything else? Good. Thank you very much.
Okay. Thank you all.